Welcome to Back to Basics, everyone. This is gut. I remember doing gut over it in February. This is Back to Basics on natural gut relief. My name is Dr. Vivian Asamoah. I'm a gastroenterologist and functional medicine provider in Katy. We run this live every Thursday at 6:30, and it is beautiful to see the whole community joining us tonight. Guys, go ahead and leave questions, leave comments if you enjoy the talk. I promised a patient of mine that I would play some music and dance because he said on Gut Over It, I used to dance all the time. So it is Thursday, and it's been a long week. We're looking up to Friday. We can't wait because it has been a really long week at the practice. A lot of stuff going on, a lot of changes, beginnings, and I think it's just leading to, with change comes challenges, but I think that we are going to actually do better and be a much stronger team, so we're excited about that. So this is for my patient. He knows who he is. He's 80 and I think he likes the salsa. So he said, Dr. V, you didn't dance last time. So I said, okay. Let's just enjoy the end of the week, and I hope he's watching tonight and sharing some questions. So today I wanted to talk about COVID-19 and its impact on gut disease. I thought this was a really important topic to bring up because COVID-19, no matter what, we're getting vaccinated, guys, but no matter what, we are still seeing cases of new cases of COVID-19, and we are right now seeing everything that's happening in terms of long haul COVID, and I'll talk about this in more detail. But in doing the research, I learned a tremendous amount, and I thank Donna also for helping me pull some of the data together. There are a lot of studies out there, and this is a beautiful thing about medicine, right? Actually showing the data, doing the research, looking at meta-analysis. And there are studies that's wonderful because we have global studies. We have studies from Wuhan, we have studies from China, from Italy, from Europe, and we're seeing and the United States, of course, and we're seeing some great information. There's some great information that everyone is sharing. So if you all can see me, just put in a comment so I know that you guys can all see me okay. I want to make sure that this is running all right. So I'm going to actually leave a comment so I can really get started. All right, so engagement and feedback is good, guys. It's what helps me get motivated and excited to really share as much as I can. But this was an interesting topic. And so I went as far back. Wonderful. Thank you, Nicole. I went as far back as, when we started seeing cases of COVID-19, there was a lot of controversy as to whether it was purely an ear, nose, and throat, nice to see you well, ear, nose, and throat pulmonary issue, or whether there was truly GI implication. And it took a while, quite a few cases, and some misdiagnosed cases, like patients who presented with GI symptoms and the connection, they weren't tested for COVID-19 and that connection wasn't made. But if you look at the data, about 30% of patients who have active COVID-19 disease infection actually present with GI symptoms. And the symptoms range from the one we know most commonly, which is the lack of smell and taste. I mean, that's a GI symptom, right on the tongue, to heartburn. Nausea, vomiting, loss of appetite is a very common symptom, and diarrhea, right? And so over time, we started identifying these GI symptoms as being, a possible sole presentation of COVID-19 or an adjunct, sort of in addition to some of the pulmonary symptoms. But what became even more apparent, more evident, was that a lot of the patients who presented with GI symptoms had more severe forms of COVID-19. Their prognosis was worse. A lot of them ended up in the ICU. A lot of them ended up on the ventilator, and a lot of them ended up dying, right? So the mortality was much higher. And that kind of went back to the original, the post that we posted on our natural gut relief group today, on Monday, about leaky gut and dysbiosis increasing the prognosis, which really means the severity of a disease, and notably COVID-19. So multiple studies have shown this. It wasn't actually just that microbiologist, Dr. Kim, but multiple studies have shown that when someone at base has bad gut, chronic gut, chronic gut issues that's not well maintained, not well controlled, or is even unaware of, when they get COVID-19, they generally have a more aggressive and more severe form of COVID-19. So that was really interesting information. And I dug a little bit deeper and I found out why, and the whole when we talk about pathophysiology in medicine, we talk about the mechanism of COVID-19. Now it's very complex because we're talking about that. You guys know what the spiky COVID looks like. Well, those spikes attach to ACE receptors. These are specific receptors on the epithelium that line certain organs. And these receptors are heavily populated in the lung. And guess where? The gut, the intestines. Actually, I read that the GI tract has 100 times more ACE receptors than even the lungs. So it is a direct point of attack for COVID-19. And that's why a lot of people have the symptoms that they do. And as we've discussed many times before in previous videos, the GI tract does harbor almost 80% of the immune system of the entire body. So it became evident that this was an extremely important part of the pathophysiology, the mechanism of COVID-19. Now, so they started looking at patients with COVID-19 and they're assessing their stool. And you can actually see that the virus sheds in the stool. And the virus can actually linger in the stool for up to 19 days. So this raised a whole bunch of questions about, is social distancing enough? When you go to the restroom, right? Are we getting exposed? Is the timeline for quarantine enough, right? The 14 days or 10 and 14, should it be 19? Should it be 21? But some studies have shown that although you can shed the virus for as long as 19 days in stool, it doesn't necessarily mean that there's an active quantity. There's like a large quantity of the virus in the body. So they kind of stuck to their 14 days and the 10 days, saying that most of the time, which makes sense, right? The contact through droplets rather than fecal oral, which is, stool going into the mouth or vice versa, is probably a more common mode of transmission than the other way around. So that was really, really interesting. And they saw that a lot of people who had underlying GI conditions, again, these would be conditions where it's not under control, there's a component of leaky gut, had more severe forms of COVID-19 as well, had more severe disease. So I want to talk about some medications that have been associated with more severe forms. And this, again, loops everything back into the gut. Proton pump inhibitors, all right? There are many studies right now that show that those proton pump inhibitors like Nexium, pantoprazole, omeprazole, that actually reduce acidity in the stomach. And that acid is in the stomach to actually do what? Kill bacteria, kill viruses, right? It has a very harsh effect when you eat, ingest, or swallow things that are high, even, from aerosol droplets, right? That would go into the back of the throat. You would swallow that. If you had the normal amount of acid in your stomach, which is a pH between 0 and 4, you would kill it. But when you're when you're using these omeprazoles, Nexium, these acid blocker medications long term, you lose that ability to produce acid, right? Because it's suppressing it. And there, bacteria, virus, and other pathogens flourish. So there's a lot of studies that are actually showing that the PPIs may not be beneficial, are not beneficial. There are a few studies that show that H2 blockers, which is Pepcid, famotidine, although it does suppress acid a little bit, it doesn't suppress it as much as omeprazole and Nexium. And that actually was shown to be beneficial to manage patients with active COVID infections, because Pepcid also has an antihistamine effect, which has a slight anti-immunological effect. So I would use Pepcid at a low dose in someone who had an active COVID-19 infection, but I would try and pull them off a PPI unless I really had to, like they had ulcers and other things like that. So that was really good information. So I want to talk about now, sort of jump into, move away from people who have active COVID infections and now kind of talk about GI, underlying GI comorbidities or diseases that we're now kind of trying to pay a little bit closer attention to see how they are impacted by active COVID infections or how they respond after they have COVID-19. And I'm going to talk about two groups because I have a lot of patients with inflammatory bowel disease who've been really concerned about one, getting COVID-19 because they usually are on immunosuppression medication. So our patients with inflammatory bowel disease, and that is um, an autoimmune reaction where the gut is sort of like attacking itself. And this can happen from mouth to anus. Typically, we see it in the small bowel, we see it in the colon, and the names we give for it, if you've heard of Crohn's disease and ulcerative colitis. And people with Crohn's disease and ulcerative colitis generally can manage some of their milder symptoms with diet and nutrition. But for the most part, a lot of them are, especially when seen by conventional doctors, are taking immunomodulators or immunosuppressants. So medications that suppress the immune system. So if you guys know of any medications that are biologics, which are also immunosuppressants, please type it in the comment box so I know that you're all still following along. All right, that I'm not just talking, nobody's listening to me. But one example, I want someone to give me one example of a biologic. But because our patients are taking these medications, they're very worried that they will not be able to mount an immune response to a COVID-19 infection. So there's a registry of IBD patients called the IBD Secure, and they have been accumulating data on now maybe thousands of maybe hundreds. I think they said about 300 to 500. The number may have increased now, of patients with IBD who got COVID-19 infection who were on some form of a biologic, right? And so, example, Humira, Remicade, Stelara, those are examples of biologics that really suppress the immune system. And just to kind of assess and see whether they were worse off when they had COVID-19. And they didn't see that that was the case. And that was really interesting, right? They didn't see that was the case. However, what they did note were there were two medications that we usually do prescribe in the setting of an IBD flare that were associated with negative outcomes when they had COVID infection. The first was steroids, and we can understand that because steroid is a very potent immunosuppression medication, so it just kind of shuts down the immune system. So their recommendation was if your patient has IBD and developed COVID-19, try not to use steroids. Get them off steroids if they're taking steroids, right? So steroids were an absolute no-no. And the second medication, and I was quite surprised about this because it's actually the one that's considered to be the least harmful, not as strong or potent as the others, were the 5-ASAs. So that's like mesalamine, pentasa, Lialda. Well, a lot of patients on those medications, according to the research, had more severe COVID-19 infections compared to even patients on Remicade, Humira, and the other biologics. Now, they did say, and this is really, I'm really trying to talk to our patients with inflammatory bowel disease, that when you were on combination therapy, sometimes we'll put our patients on Humira and azathioprine or 6-MP, another immunomodulator, that kind of weakened your immune system and made you also a little bit more prone to more severe infection. So the bottom line here was, if you have IBD and you get COVID-19 infection, we as your providers had to be really careful not to put you on steroids or pull off steroids. And we had to really let our patients know to stay really focus on the social distancing. Don't go out there. Don't expose yourself. Stay gloved, stay masked. Don't really try and avoid just exposing yourself and your family. Now, when it came to vaccination, however, no contraindications, no major issues. But the conversation about vaccination once you've had COVID and what the outcomes are is a conversation for another day. There's so much information that's coming out in the research that I think it's even too soon to really understand what's going to happen to our patients who had COVID and who get the vaccine, because we're already starting to see different types of reactions. Okay, so that's what I got about IBD. That's a huge population of patients that I see. I love my patients with inflammatory bowel disease because they truly live with chronic gut illness and are doing their very best, especially in my practice, to use diet and nutrition to really help alleviate and reduce inflammation in their gut. So I was doing a lot of research for them and going back and forth on messages. The other one that I want to bring up is chronic liver disease. And I'm talking about patients with even just fatty liver disease. And how do you know you have chronic liver disease? Well, sometimes your liver enzymes are high, they're elevated, and your doctor sends you off to see someone like myself who treats a lot of people with liver disease to figure out what the cause of the elevated liver enzyme is. And we're trying to figure out, is it because you had a few too many vodkas last night, or is it really because this has been going on for a while and we need to figure it out? So guys, remember this. If your doctor says you have elevated liver enzymes, you're going to need to go see a GI doc or a hepatologist. Make sure that you stop drinking all alcohol immediately, because this could prevent a huge workup, right? Because that may have just be because you drank even just the day before or 3 days before. If you had went out with friends and had a couple, maybe 3-4 cocktails, and then you went on Monday and got your blood work done with, after the weekend, your doctor may find that your liver enzymes are slightly elevated. So before they send you over, say, doc, hold on, let me just clean up, let me detox and repeat this test. That will avoid, expensive blood work and everything. So just know that. But going back to our patients with chronic liver disease, this is a confirmed diagnosis of chronic liver disease, either autoimmune, viral hepatitis, and most commonly what we see today is fatty liver. And they kind of look to see, well, how does COVID-19 infection impact the liver? We do know that a lot of patients with COVID infections have elevated liver enzymes. First cause is most likely because their body is in a state of shock. So when the body is in a state of shock, the liver cells just kind of burst and release a lot of enzymes. The second part is probably because of medication. And so a lot of the medications they actually give for COVID-19, right, the remdesivir. And they're saying that this medication actually they could not give it to patients who had cirrhosis, which is sort of more the end stage liver disease, very fibrotic liver, or who had elevated liver enzymes 5 times greater than the upper limit. So if the upper limit is 20 and their liver enzymes went up way beyond, like at 100, they could not administer the drug because they were concerned that it would cause an acute liver failure. So that was interesting. But what they did see again, I guess with other comorbidities, like if you have medical issues, it kind of ran into the same thing. If you have chronic liver disease and it's well controlled, what we call compensated, you're not having yellowing of the eyes, you're not having water in your belly, what we call ascites, or water in your feet, and you were well compensated, you got regular checkups, they didn't see that prognosis was worse. But in people who had liver disease and had active flares, maybe continued to drink, or had active infection, active issues related to their liver, they saw that the prognosis was indeed worse. But what they touched on in terms of liver disease and COVID-19 and its impact was a lot of people who were on the waiting list for liver transplant, who had liver cancer and were on the waiting list, or young children who had genetic causes of liver disease and needed to get a transplanted liver, could not get it because everything was shut down. And so that was kind of sad to learn that a lot of people actually did lose lives, not because of the way COVID directly impacted their health, but because of the care they couldn't receive. And I think all providers have experienced this and seen that it has really, almost put a freeze on care of chronic illness, which is why prevention is so important, right? So important. So I just want to make sure I'm giving you guys all the facts. We're going to move right now into long haul COVID. We're hearing this around a lot. There was a recent recording on NPR. Donna told me about this, about long COVID. And I started seeing it a lot in clinic as well. So these are patients who had COVID infections and it's over. Like they thought they recovered. They did well for a while. They passed quarantine, but some symptoms just never go away. I don't know if anyone here had COVID or is experiencing something like this or knows of people who are experiencing this, but it's become such a big deal that the NIH got a huge grant from the government to start doing some serious research about how do we even identify who's going to be at risk for long haul COVID and how do we prevent it, because they're seeing a lot of symptoms. So Donna shared some information with me about they're seeing that this is happening a lot in people with vitamin deficiencies. So vitamin D deficiency, they're seeing it in older women. And I wonder why. It could be because autoimmunogenicity, like autoimmune disease, is very often associated with the female gender. I'm sorry if I'm going too fast, guys. I have a lot of information to share. I'm very excited. So I will slow down. And if you guys have questions, please put it in. But there's some great information here. So low vitamin D. So you definitely don't want to be vitamin D deficient. And that's something easy to take, right? Older women, and I think it could be maybe in part hormonal. It could be in part related to the fact that, yes, women do have are more prone to autoimmune disease. They're seeing it a lot in patients with asthma, right? Suffering from that long haul COVID. And some of the symptoms include chronic fatigue, like you would see in Lyme disease, Epstein-Barr, CMV, right? Shortness of breath, brain fog, sleep disorders, GI symptoms. I have seen at least 2 cases of delayed stomach emptying, IBS, post-COVID, right? So I think we're going to see more and more of this. And as gastroenterologists and as functional medicine providers, it is key that we learn how to help our patients, because this can cause, significant distress in quality of life, right? Significant impact. So anxiety and depression makes sense because of that brain-gut connection. And it can persist for months, ranging from mild to incapacitated to horrible. Okay. And these symptoms are sometimes evolving over time. So it could be that someone has GI symptoms for a couple of weeks, and then next they're dealing more with brain fog. So it just tells us how much an infection can ravish the entire body. And up to 15% of patients with long haul COVID are experiencing gut symptoms. And when I read all these papers and saw the meta-analysis and kind of looked at the work that the NIH was doing, I think it really, really solidified my approach and my drive and my true belief in an integrative functional medicine practice. Because we've always said, all disease begins in the gut. And what you put in your body, what you eat, you are what you eat is what we say, right? And so the biggest take home for me here was prevention is key. And what we're trying to do in this group for our natural gut relief group is stay healthy, understand the foods that keep us healthy, understands the foods that destroy our gut and cause things like leaky gut and weaken that intestinal barrier that does cause other systemic issues, right? And be able to share that information with the people we love around us and use food as medicine, and make sure that we're repleting our bodies in a very wholesome way. Another thing that it brought up was that too much exercise. I know we're doing our 10,000 step challenge, and I'm going to be walking after this. So kudos to all of you guys doing it. Keep going. But the one thing they brought up is that they saw a subcategory of patients who over-exercise. So these are people who are at the gym for like 3 hours a day. They're taking all sorts of supplements, all sorts of shakes, and they're not allowing their bodies to rest. And they've got mitochondrial dysfunction. I was sharing this with another colleague today. They're seeing those people have worse COVID outcomes as well, and also suffering from this long haul COVID. So it's really important day to day to prevent. Allow your body to rest. We are not machines. Don't overdo it, right? and really make sure that you're supplying your body with the right nutrients. It's already 6:57, guys. I think I'm going to have to do another talk on the right nutrients for long haul COVID. If you all have any questions, know anyone with long haul COVID, let them know. There's so many resources that I would like to share, and that's probably what I'll do. I mean, vitamin D, zinc, making sure you're taking the right amount of vitamin C and antioxidants, quercetin, omega fish oil, high dose. There's so much you can be doing right when you have COVID. So many things that you should be taking even after the infection is done so that you don't develop long haul COVID. So I hope this was helpful. And if you guys have any questions, I'm available. Please type it in the comments. If you enjoyed this, please leave a like, share some love, share this with someone, invite friends and family to the group so we can all learn from each other. All right, so this was Back to Basics. I will be back next week, Thursday. It will be live at 6:30. And this month is actually, and April is IBS Awareness Month. And I want to honor one of my patients who suffers from irritable bowel syndrome. So I will be interviewing her next week, Thursday. It will probably be a Zoom, but it'll be a Zoom live. And I kind of just want to bring her journey and her story to light, shed some light, share some information with everyone, and how she has used natural solutions, natural herbs, natural, foods to actually help resolve her symptoms. She's not on a single medication, so I definitely want her to share her information, and I am extremely excited about Zooming with her next week. So y'all, I gotta go walking before it gets dark out there. Have a wonderful evening, and I will see you soon. Bye-bye.